Before we ask our First Lady to come round to theatre, at the beginning of each day and before each operation, the theatre team will have a short meeting to discuss the ladies who are delivering that day. At that point, we'll highlight any expected problems, and this enables the team to plan your care in the safest way possible. So once your obstetrician, your anaesthetist and your midwife have checked that everything is in place and the theatre team are ready, your midwife will escort you and whoever's joining you in theatre to come down to the theatre complex. It's located next to the delivery suite and only a minute or two's walk from the postnatal ward. If you need any assistance or even a wheelchair, then we can provide that for you. When you reach the door to theatres, your partner will be asked to get changed into theatre clothing, including shoes and a hat. They'll then be asked to have a seat outside the operating room until we call them through. Whilst they're waiting, there's a poster on the wall which gives relatives some information about what they can expect during the procedure. While this is happening, Mum will be led into theatre and asked to sit on the edge of the operating table. One of the theatre team will then check you in to confirm we have the right person for the correct procedure. This is usually happening whilst your anaesthetist is inserting a cannula into your hand or arm, and to this we will connect some salty water fluid and a drug which aims to prevent your blood pressure dropping when you have your spinal injection. We'll attach a cuff to your arm to monitor your blood pressure, and this will go tight every few minutes until your operation's finished. You'll also need a pulse monitor on your finger and some stickers on your chest to monitor your heart. You'll then need to have your back sprayed with some very cold antiseptic. We'll warn you before that happens because it's cold. And your back will then be draped with sterile blankets, and an injection of local anaesthetic is then used to numb the skin. This can sting initially, but then after the numbness has started to take effect, the spinal injection through the numb skin shouldn't be uncomfortable. By attempting to curl your back over as shown here, you'll help your anaesthetist considerably in locating the correct spot as quickly as they can. We do appreciate that with a baby in your tummy this isn't easy to do. Your position for a spinal epidural is very important, and as you can see here, the table is slightly tilted to help you achieve as good a position as possible. Your anaesthetist will talk you through everything as they're doing it, and the process of preparing for the spinal and performing it usually takes about 10 or 15 minutes. It can take considerably longer than this, but if we're predicting that, then we will normally discuss with you and warn you that beforehand. Once the painkiller has been injected, you'll be asked to lie down onto your back on the table, and we'll slightly tilt it to the left. Your partner will then be giving a seat next to you and a screen put up so that you're not able to see any of the surgery happening, and we can also keep the operating area very clean and sterile. Before the operation can start, a catheter tube will be inserted into your bladder by your midwife. By the time this happens, you should be very numb and so will feel very little. During these few minutes, your anaesthetist will be assessing how numb you are and explaining to you what to expect through the procedure. The sensation is very strange and subjective, but one thing's for sure, there should be no pain or sharpness. We won't start until you and your anaesthetist are both happy that the spinal is working really well. If you are unsure of anything, then your anaesthetist is there to reassure you and answer any questions you have about anything throughout the procedure. Depending on how difficult your obstetrician expects the section to be, it doesn't usually take long to deliver your baby. There may be a short delay after delivery before the obstetrician cuts your baby's umbilical cord. Your midwife will then transfer the baby over to a resuscitate under a heater and spend a few minutes just assessing briefly and checking the health of your baby. Once he or she has been dried and wrapped in warm towels, you and your partner will be able to hold the baby until the end of the procedure. During this time, your midwife will aim to weigh the baby and maybe administer a dose of vitamin K if that's what you discussed beforehand. At the end of the procedure, we'll ask your partner to take the baby and wait next door in the recovery area whilst we administer any further pain relief and transfer you across from the operating table onto your bed. Once you're in recovery, we'll continue to monitor you closely for about half an hour, depending on how the procedure's gone and whether there have been any problems that may need you to be addressed at that time. You may still be connected to a drip in your arm containing a drug which helps your womb contract. This acts to prevent any excessive bleeding after your delivery and will normally run for about 4 hours. During your time in recovery, you'll have a nurse and a midwife to look after you and your baby. You'll be encouraged to have a drink and something to light to eat at this stage, as well as to feed your baby, either by breast or bottle. When your recovery nurse and your midwife are ready, you'll be transferred back to the postnatal ward or to the delivery suite if we feel we need to observe you more closely for a time. Your caesarean section would normally take 1.5 to 2 hours between leaving and returning to the postnatal ward, as long as there have been no problems or complications.